Welcome to the Doctoring Differently podcast. I'm Dr. Naomi Lawrence-Reid, your host, a pediatrician and creator of Doctoring Differently, where I teach physicians how to explore exciting, flexible, and lucrative careers beyond full-time clinical medicine. Each week, we're diving into a topic to help you doctor differently. Follow us everywhere on social media at Doctoring Differently and subscribe to the podcast at Spotify, Apple Podcasts, and YouTube. Now let's get to today's episode. Today, we're exploring a topic that many of us know all too well, burnout. We'll hear from physicians who reached their breaking points, but then found paths to healthy, fulfilling careers. The purpose of these stories is to encourage those of you who are experiencing burnout, but unsure how to take a step towards change. I want you to be encouraged by these stories and know that you are not alone. There are others who started in similar situations and have found pathways and inroads to careers that they love. First, we'll hear from Dr. Kalie Dove-Maguire, an emergency medicine physician in the Bay Area who loved her work but ultimately found herself burning out. She shares how that burnout led her to step away from clinical practice and find a creative, innovative, and lucrative role in tech that allows her to make a broader impact as she develops products that make doctors' workflows more efficient.
Yeah, 100%. I thought I was so I loved residency. I don't know, residency is hard. So I was very burned out in residency, but I loved the clinical work. I loved taking care of people. I loved, not having any barriers between me and the patient. Anybody off the street, I would be able to take care of. So that part I loved. I actually thought I was going to be a full-time clinical community doctor. Post-residency, took a full-time clinical job, thought I was going to be a full-time clinical doc and was thrilled to do it. But then after I was out, I was working, more than my contract said. So I there was definitely a component of burnout, but I also was kind of looking around being I was a little bit unfulfilled. And the thing that I didn't put enough importance on when I was in residency was all of these kind of larger scale projects that I worked on. So I worked at the WHO. I did a big informatics project while I was in residency, but I didn't realize that's what informatics was when I was there. I did this clinical decision support. I just didn't realize that was what I was doing. And those were the things that really gave me the big level of fulfillment. And so when I went straight clinical, working 22 plus shifts a month, that was a lot. And I was missing that, upstream sort of thing. So I kept, patching people up, but I really wanted to I described it as plugging holes in a ship, but I just wanted to build a better ship.
Oh, what a great analogy. So, all right, your story sounds so similar to mine. What was kind of the moment, if there was a final straw moment or a time in your life soon after residency as an attending where you thought, you know what, this is the time to make a change or make a move or really start the process of exploring and custom making my own type of career?
Yeah, that's such a good question. I don't know if there was one final straw moment, but I remember the period of time when I made the decision. And so I worked for Kaiser post-residency. It was a phenomenal job, great benefits. They had an EMR that worked. The patient population was awesome because I worked at a couple different sites. So I got there was a large non-Kaiser patient population I got to take care of. But I looked around a year in being okay, so 10 years from now, I'm still going to be doing this. I'm going to be having the same job. And I just was I need something else. So I needed that, I needed more WHO work. I needed more, large scale work. And I couldn't figure out how to make it work with the current job. Because at the time they had this very restrictive contract. So you couldn't do anything external while you were working full time for them, which,
yes.
I understand has changed now, but at the time it was one or the other. So it was a tough decision for me. And it was probably the hardest decision I ever made was to jump off that train, because in med school we do med school, we do residency, then we're okay, fellowship. Oh, not fellowship. Okay. Best job I could get. And then I was, and they describe it like the golden handcuffs because you have this amazing pension and all these things. And I knew that I was okay, I got to jump off this train before those handcuffs get any tighter because this is, I could see it. And so that's why I decided to leave early. So I quit the full-time job. I kept working per diem because I'm still paying off my med student loans, but I didn't start that exposure until quitting that, job and having enough time and mental space to be able to explore those other interests.
Thank you so much for saying that. I think that our paths are, unbeknownst to me, until this conversation, our paths are so much similar than I think I even knew. I don't know about you, but for me, I had a lot of side eyes and a lot of interesting looks from classmates, colleagues, mentors who told me, I don't know, I'd be curious if you got the same pushback, but at least in pediatrics, no one leaves. No one doesn't do full-time clinical medicine unless you have a good reason to, which as women usually means, you're going part-time because of your family or because of a spouse's job or that kind of thing. But so few actually, it's just like, no, I actually want to try and explore and do other things. Did you have any pushback from your colleagues or the people in your field?
Yeah, I think there was a lot of pushback. I think honestly, though, there was a decent amount from my own head. I had a little bit externally, but like in my own head, I was like, what are you doing? This is a terrible idea. Like, you're giving up all these things. Like, Kalie, you need health insurance. Like all of these big things that I had to kind of weigh on. And my parents are very supportive too, but they're also like, you need job security, you need to have insurance, you need to have retirement, like all these things. And I was like, I know, but I'm slowly dying every time. So I need to like make a change. And yes, I got pushback. But I don't know. I powered through. And about like 3 to 6 months afterwards, I was like, dear God, that was the best decision I ever made. It was the hardest decision, but it was the best decision. And when I say I wasn't working full time, I was still like working a full-time ER schedule. It was just on my terms, which meant like all the world to me because I, suddenly wasn't overscheduled all the time. I could have the mental break to be able to, think about other things.
Our next guest is Dr. Amy Fogelman, an internist in Boston who, after years of clinical practice, found that her non-clinical work as a medical expert witness truly brought her joy. Her journey is a powerful reminder that sometimes what fulfills us may be outside of what we initially envisioned for our careers.
So my first job was a primary care job. I was in an academic practice at Mass General Hospital in Boston. It was the best practice. And the boss of my practice was an old friend of like my parents and an old neighbor of mine. So he was like the mentor of all mentors. And I had some wonderful women physicians that were in the group that were great at sharing. There was no competition. It was all about sharing everything that and interests and giving career advice. And it was great. What I realized actually is that the non-clinical stuff that I had been doing, even though it was not being compensated, it was actually the stuff that I was enjoying the most. Oh, okay. And the clinical stuff was not as rewarding as I thought that it was. And that was really eye-opening for me because that wasn't what I expected to figure out.
Right. I mean, that sounds like that was a very important discovery because we, of course, are trained to be clinicians and everything else is extra. And we're not necessarily taught how to do it. Well, we often fall into it in academic settings, but we're not taught. And a real doctor is clinical or mostly clinical. And that's what, quote unquote, pays your salary. And everything else, as you said, is kind of for free, uncompensated. But I'm glad to hear that you discovered ultimately that you enjoyed it. And I especially like the part where you said that a fellowship was not necessary and that you were able to kind of find this path without that.
Yeah. And actually what was interesting is so I ended up actually really burning out. This was pre-pandemic. This was in about 2018. And I decided to just take time off because I hadn't really taken any time off in my career. It was my husband that actually gave me this advice. He was like, you don't have to do this. And he's not a doctor. And I was like, what are you talking about? Of course I have to do this. What else could I do? And he said, no, you don't have to do this. Take time off. And so I ended up taking about 6 months off. I met with a coach. For the first time in my life, I really, truly thought about what it is that is inherently inside of me that I enjoy doing, what I'm good at, what I have to work at, but enjoy doing and what it is that I really wanted to look for in a job. And that was so eye-opening for me, because even my decision to choose, internal medicine, my decision to go into primary care, a lot of it just kind of happened without a real planned out thought about it. And so what I ended up doing is networking with a ton of people. And one of the first people I met with, I said, should I get an MBA? And he said to me, he goes, doctors love getting degrees. He said, but no, you don't need an MBA. He's like, these are these are like the 12 different things that you can do in the, these different categories. He's like, you need to meet, and he gave me like names of people that we knew from our residency that are in each of these places. He's like, I'll introduce you to so-and-so. Then that person introduced me to somebody else. So I ended up talking to all of these people who are doing this. Listening, really hearing about what their lives are like. What is your day like? What do you do? What is your most frustrating thing? What do you? And for me, that was just really eye-opening. And I ended up realizing that I wanted to start my own business, which was crazy. I never would have ever thought that. But that's how I got there.
Next up is Dr. Roberto Montenegro, a child and adult psychiatrist in Seattle who experienced burnout in a slightly different context. He found that the demands of academic medicine and the political dynamics of being a physician of color created the motivation to find another path. Dr. Montenegro ultimately found the courage to make a difficult first step that ended up being the right choice for him and his family.
Yes, you're alluding to my socialization into academia, right? And so doing my PhD in sociology first, I was definitely socialized and indoctrinated with the idea that I would be an academic. And my whole journey was to become an academician, be at a top-tier institution, continue to publish, continue my work in research with studying racism, microaggressions, and the impact of racism in medicine. That was my big goal, is to continue that work. And so throughout my training, I continued to teach medical students. I continued to do research. I continued to publish. I continued to apply for grants. And my first few years as junior faculty, I did stay at my home institution at the University of Washington. And it was a really great place to start as a junior faculty. I had a really amazing department chair, and the pediatrics department chair also took a special interest in my work in bias reduction and anti-racism training. And I was pretty set up, academically to just continue in that path of publish, get grants, teach, practice medicine, right? And that's all I knew. And it became very apparent at the beginning, that this wasn't really everything I thought it was, right? I was seeing how much of a big toll it was taking on myself and my family. And I was noticing that really a lot of my colleagues that were leaving because they were being treated like they're disposable, right? And they would pour their souls and hearts into the work, and politics would get involved, financial, inequities would start becoming a bit more apparent, and then the natural resentment, and then put that on top of that, the role that being a physician of color, right, plays in academic institutions, especially mostly being white-dominated academic institutions. You can see why it creates a high likelihood of burnout.
Yeah, I see that. Sure. Okay, so sounds like, I felt you choosing your words very carefully there, but very well articulated and well said about the challenges that so many physicians face entering academia, but particularly physicians of color, Black and brown physicians, and a lot of the work we find ourselves doing a lot of that labor. Of course, in the past few years, there's been a lot of DEI speak and talk, but sometimes there's not a lot of action behind it from these large institutions either. Okay, so it sounds like there were very good parts of your training initially at the University of Washington. Your fellowship was a great experience. Your first few years as an attending, as I can identify with that I was at a large academic institution for those first few years and got excellent training. And I felt that was a great first step in my attending journey and attending career. However, we got to a place where, despite not having exposure or really being told about too much about life and work outside of academia, it sounds like you chose to make a change. It sounds like it was time. You got the experience you needed, but there were also other factors that made it obvious that you needed to move to another place and space in your career. So tell me about that transition out of full-time academia.
It was a very, very, very tough transition time. Tough because many of us get, like I said, indoctrinated into the thought that you went into medicine to help people. The best way to help people is to work at a hospital or academic institution if you're being groomed into becoming an academician. And it was really terrifying to think that all these years I spent working my PhD and all these other trainings and fellowship, that I would leave the comfort of academia, despite how toxic it would feel sometimes. Despite how rewarding it was at times, leading that was very frightening, right?
Yeah.
A lot of us become dependent on these large institutions, thinking that, well, they're paying our benefits, they're paying our disability, they're paying our malpractice, and all these other things that eventually, in working with you, you were able to tell me, no, like you don't need to feel tied to an institution, especially if the institution's not really treating you in the manner that we deserve to be treated, right? And again, not at fault of any particular individuals, but really how our system in medicine works, right? And so I was very scared. I thought, okay, no one talks to me about what it's like to be a psychiatrist outside of academia. Like you said, I did feel ready in terms of my clinical skills, right? All these years as an attending, teaching residents, teaching medical students, teaching fellows, super amazing for my comfort in dealing with medicine and psychiatry. But taking that leap was something that I wasn't ready. And it took me a while to get there. And really, it was a kick in the butt that I got in terms of just being fed up with the inequities that I was experiencing as a junior faculty of color, and having support of other people that I was able to reach out, and they said, you'll be fine. This is what you need to do. And so once I saw that there was a little bit of structure and that it felt very risky, I didn't know, in my fears, right, I would end up opening my private practice and no one would show up, right? And I had that fear lingering. And so I decided, let me just do half-time, part-time private practice, and then stay in academia half-time. That way I can keep my grants, keep my research going, and try this private practice world out at the same time. And luckily, my department chair agreed, and that's how my journey started with this 3 years ago now.
Our final guest is Dr. Sarpoma Sefa-Boakye, a family medicine physician in Southern California who realized early in her career that her clinical workload was simply unsustainable. She shares the moment when she knew she needed to find something different and how that led her to reimagine her career through veteran disability exams.
So, my first few years as a practicing family medicine, in the beginning, I felt like I was making a change, kind of. I felt like in residency, our panels were smaller, so it made more sense. Panel meaning the amount of patients you took care of, right? So I probably had 500, 600 patients, even it's still a lot. It was, going into the, as an attending, 2,000 patients, 2,500 patients. I mean, I hear patient panels of 3,000 was not realistic to me. And I kind of had to think about, before I went into residency, I actually was doing work non-clinically because I was able to do, study for steps and do some non-clinical stuff that, that I could get as a foreign trained doctor. And so the work that I did as a non-clinical doctor, I was kind of like daydreaming about that when I was practicing medicine, because I was like, how can I see 30 people a day and address all of their conditions and expect them to give me 5-star ratings? Like, that was really weird. Like, I wouldn't put that on a waiter.
Right.
So that was, so it became this, my 2-year, I had like a 2-year contract at the family medicine clinic I was working at. And I literally daydreamed every single day of doing something different outside of, treating my patients, right? Because that was what I was trained to do. But I was like, this can't be it. This can't be the destiny.
I've said those exact words. This can't be what I trained for, what I sacrificed for, what I've spent so much money and time doing. We get to the point where we are treating the patients and we're having those one-on-one interactions, but 30 patients a day, 40 patients a day, you're not providing quality care. And it just seems like we have no autonomy. We have no way to quote unquote fight back and even advocate for our patients because of these systems in place that prevent us from doing so. Okay, so we're daydreaming about non-clinical work that you were able to do before residency because this is the type of work available to foreign medical grads. But okay, so let's talk about that next step. So you had a 2-year contract, and then we're still family medicine. Is our pivot coming soon? Where's your mind at here?
Oh, so the pivot came when I actually was like, I'm going to go into some of these Facebook groups. I'm going to listen to some of these podcasts. I'm going to try to listen to other like-minded folks and to see what they're doing. Because I just thought, is it just me? Am I the only one that feels like this is right, not right? And I was wrong. It was not just me. It was so many of us. But at the time, I think now it's like the buzzword. People didn't talk about like now if you go into a clinic, like I even, I hear doctors will tell the patients that they're burnt out, right? Wow. So you hear it. Yeah. During when I was practicing, you'd never talked about it. Like it was like, we just got like our little lunch talks and says, hey, here's a Massage Envy gift card, or I don't know, whatever they tried to do. So with that, I decided to get a coach.
Okay.
It was the best, I would say the best decision that I made after residency was to talk to someone. Like it was like therapy for a burnt out physician, it's like, because like a psychologist, I don't know if he or she'd be able to understand that, but it was actually a physician who walked me through and said, this is what I went through and this is what other physicians are going through. And so here's a workbook. Every week we had to work through all of the, like it was so many imposter syndrome, all these different things that you're like, what? Like I could be going through that. Like I think that I don't know what I know, And so that really was what catapulted me. So after my contract ended, I was, my previous belief was that I was just going to go into another clinical position thinking that it was going to, solve and,
be better.
There's not enough money. Yeah. They think, add extra money on top of it. No. Be in a different city, closer to the beach. No, like it really was at the point that I was at in my life, I needed something different, completely different, where I had more autonomy and where I felt like I used my brain. And so that's what led to where I am today.
As you've heard today, burnout is something that many of us experience, but it doesn't have to define our careers. Each of the doctors featured today found a way to move beyond burnout and discover new paths that brought them fulfillment. Whether it's exploring non-clinical roles like Dr. Fogelman or finding a way to impact healthcare on a larger scale like Dr. Maguire, there are many ways to doctor differently. Thank you for joining me on this journey. If you're ready to explore your own options, visit doctoringdifferently.com for resources and guidance. And be sure to subscribe to our podcast for more stories of physicians navigating new career paths.